We've all heard it, the rumbling, vibrating sound of someone snoring. It's a sound that can be both amusing and annoying, depending on whether you're the one snoring or the one trying to sleep next to the snorer. It's a common occurrence, often met with amusement or annoyance, but beyond the initial reaction, snoring can have deeper implications for both the snorer and those around them. But have you ever wondered what causes this nightly symphony? What exactly is happening in our bodies to produce such a sound? Snoring happens when the flow of air through your mouth and nose is obstructed during sleep. This obstruction can be due to various reasons, such as the position of your tongue, the relaxation of throat muscles, or even the structure of your nasal passages. This obstruction causes the tissues in your throat to vibrate, producing the characteristic snoring sound. The vibration is similar to how a musical instrument works, where air passing through creates sound. Imagine a flag flapping in the wind. The stronger the wind, the louder the flapping. This is a simple way to understand how airflow affects the sound of snoring. Similarly, the more restricted the airflow, the louder the snoring. The severity of the snoring can vary from a soft murmur to a loud, disruptive noise. Several factors can contribute to snoring, including the anatomy of your mouth and nose, allergies, nasal congestion, alcohol consumption, and sleep position. Each of these factors can influence how much your airway is obstructed during sleep. While occasional snoring might seem harmless, it can sometimes signal a more serious underlying condition called sleep apnea. Sleep apnea is a disorder where breathing repeatedly stops and starts during sleep, leading to poor sleep quality and other health issues. Understanding the causes of snoring is the first step towards identifying potential sleep disorders and seeking appropriate treatment if necessary. By addressing the root causes, you can improve your sleep quality and overall health. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. These interruptions can significantly affect the quality of your sleep, leaving you feeling tired and unrested. These pauses, called apneas, can last for several seconds and occur multiple times throughout the night. The frequency and duration of these apneas can vary, but they often lead to fragmented sleep and reduced oxygen levels in the blood. Obstructive sleep apnea, OSA, is the most common type of sleep apnea. It affects millions of people worldwide, often going undiagnosed and untreated. OSA occurs when the muscles in the back of your throat relax too much during sleep, causing your airway to narrow or even close completely. This can happen repeatedly throughout the night, disrupting your sleep cycle. This obstruction blocks the flow of air, leading to the apneas that characterize this condition. The brain senses this lack of oxygen and briefly rouses you from sleep to reopen your airway, often without you being aware of it. Imagine a garden hose with a kink in it. The water flow is disrupted until the kink is straightened out. Similarly, your breathing is interrupted until the airway is cleared. Symptoms of OSA often include loud snoring, which can be disruptive not only to you, but also to your sleeping partner. Other symptoms include gasping for air during sleep, excessive daytime sleepiness, morning headaches, and difficulty concentrating. These symptoms can significantly impact your daily life and overall health. If left untreated, OSA can have serious consequences for your health and well-being. It can increase the risk of high blood pressure, heart disease, stroke, diabetes, and other serious health conditions. Recognizing the signs and symptoms of OSA is crucial for early diagnosis and intervention. Treatment options are available that can help manage the condition and improve your quality of life. Untreated sleep apnea is like a ticking time bomb, silently wreaking havoc on your body. The repeated drops in blood oxygen levels and disrupted sleep patterns associated with OSA can contribute to a wide range of health problems. High blood pressure, heart disease, stroke, type 2 diabetes, obesity, and depression are just some of the conditions linked to untreated sleep apnea. Imagine a domino effect. One health issue can trigger a cascade of others. Moreover, OSA can also affect your quality of life, leading to daytime sleepiness, fatigue, irritability, and difficulty concentrating. This can impact your work performance, relationships, and overall well-being. Addressing sleep apnea is not just about getting a good night's sleep, it's about protecting your long-term health and improving your overall quality of life. Making simple lifestyle modifications can significantly improve sleep apnea symptoms for some individuals. These changes can be easy to implement and can lead to noticeable improvements in sleep quality and overall health. These changes focus on promoting a healthier weight, reducing airway inflammation, and improving sleep hygiene. By adopting healthier habits, you can create a positive impact on your sleep patterns and reduce the frequency of apnea episodes. Losing even a small amount of weight can make a big difference in reducing the severity of sleep apnea. Studies have shown that weight loss can lead to a significant reduction in the number of apnea events per hour of sleep. Excess weight, especially around the neck, can put pressure on the airway, making it more prone to collapse during sleep. This can lead to more frequent interruptions in breathing and poorer sleep quality. Regular exercise and a balanced diet are key to achieving and maintaining a healthy weight. Incorporating physical activity into your daily routine and making healthier food choices can help you manage your weight more effectively. Avoiding alcohol and sedatives before bedtime is crucial, as they can relax the throat muscles, worsening sleep apnea. These substances can also disrupt your sleep cycle, making it harder to get a restful night's sleep. Quitting smoking is another essential step, as smoking can irritate the airway and increase inflammation. This can exacerbate sleep apnea symptoms and make it more difficult to breathe during sleep. Creating a relaxing bedtime routine, ensuring a comfortable sleep environment, and getting enough sleep can also contribute to better sleep quality and reduce sleep apnea symptoms. Simple changes like dimming the lights, using a sleep mask, and setting a consistent sleep schedule can make a big difference in how well you sleep. Section 5. CPAP Therapy. A steady stream of relief. Continuous positive airway pressure or CPAP therapy is the most common and often the most effective treatment for moderate to severe sleep apnea. CPAP therapy involves wearing a mask over your nose or nose and mouth while you sleep. The mask is connected to a machine that delivers a constant stream of pressurized air, keeping your airway open and preventing apneas throughout the night. Imagine a gentle breeze blowing through your airway, preventing it from collapsing. While CPAP therapy can be highly effective, it may take some time to adjust to wearing a mask at night. Working closely with your doctor to find a comfortable mask and settings is essential for successful CPAP therapy. Section 6. Oral appliances, opening up the airway. For individuals with mild to moderate sleep apnea or those who cannot tolerate CPAP therapy, oral appliances offer an alternative treatment option. These devices are custom fit by a dentist and worn in the mouth during sleep. Oral appliances work by repositioning the lower jaw and tongue slightly forward, helping to keep the airway open. Imagine a mouthguard that not only protects your teeth but also improves your breathing. While oral appliances may not be as effective as CPAP therapy for everyone, they can provide significant relief from sleep apnea symptoms and improve sleep quality. Section 7. Surgical solutions, addressing the root cause. In some cases, surgery may be recommended to address the underlying anatomical factors contributing to sleep apnea. Surgical procedures aim to remove excess tissue or reposition structures in the mouth, nose, or throat to enlarge the airway. These procedures can range from minimally invasive techniques like uvulopalatopharyngoplasty or UPPP to more complex surgeries like maxillomandibular advancement or MMA. Surgery is typically considered when other treatment options have been unsuccessful or are not suitable for the individual. Section 8. Positional therapy, finding the right sleep position. Believe it or not, the position you sleep in can impact your sleep apnea. Sleeping on your back can cause the tongue and soft palate to relax and collapse into the airway, worsening sleep apnea symptoms. Positional therapy involves training yourself to sleep on your side instead of your back. This can be achieved using various methods, such as special pillows or devices that make sleeping on your back uncomfortable. While positional therapy may not be suitable for everyone, it can be an effective treatment option for some individuals with mild to moderate positional sleep apnea. Section 9. Nasal devices, clearing the path for airflow. For some individuals, nasal congestion can contribute to sleep apnea by obstructing the flow of air through the nasal passages. Nasal devices, such as nasal strips or dilators, can help to open up the nasal passages and improve airflow. Nasal strips work by gently lifting the sides of the nose, widening the nasal passages. Nasal dilators, on the other hand, are small, flexible devices that are inserted into the nostrils to hold them open. While nasal devices may not directly treat sleep apnea, they can be a helpful adjunct therapy for individuals with nasal congestion. Section 10. Early detection, effective treatment, the key to a healthier life. Early diagnosis and treatment are crucial for preventing the serious health complications associated with untreated sleep apnea. If you suspect you or someone you know may have sleep apnea, it is essential to seek medical advice promptly. A sleep specialist can assess your symptoms, perform a sleep study if necessary, and recommend the most appropriate treatment plan based on your individual needs. Don't ignore the warning signs of sleep apnea. Taking proactive steps to address this condition can significantly improve your sleep quality, protect your health, and enhance your overall well-being. Section 11. Listen to your body, seek expert advice. Your body has a remarkable way of communicating its needs. When you experience persistent snoring, excessive daytime sleepiness, or other symptoms suggestive of sleep apnea, it's your body's way of signaling that something is amiss. Don't dismiss these signs as mere inconveniences or signs of aging. Seeking medical advice and getting tested for sleep apnea is the first step towards understanding your condition and exploring available treatment options. Remember, you are your own best advocate when it comes to your health. By listening to your body and seeking expert guidance, you can take control of your sleep health and enjoy a healthier, more fulfilling life.